I am pleased to emphasize how the Sierra Leone Personnel Deployment Plan and its mechanisms align perfectly with the broader strategic vision of our nation. This comprehensive plan is in response to the lessons learned from significant public health emergencies such as the Ebola outbreak, the COVID-19 pandemic, and the Wellington fire disaster. It recognizes that these crises have profound and far-reaching impact on human health, livelihoods, and the overall development of our country. For the Ministry of Health, and indeed for the entire country, this plan signifies a monumental leap forward in our preparedness and response capabilities. It ensures that we have the dedicated, highly trained, and rapidly deployable workforce at both national and subnational levels. This means that we're better equipped to respond swiftly and effectively to any future public health emergencies, be it infectious disease outbreaks, chemical releases, natural disasters, or other critical incidents. The Sierra Leone Personnel Development Plan is not just a document. It is a testament to our collective dedication to ensuring the health and safety of every Sierra Leonean. Let us continue to work together, leveraging our expertise and resources to implement this plan effectively. Through this concerted effort, we are fortifying our nation's resilience and ability to respond to any public health emergency that may arise. Together, we're building a safer, healthier, and more prosperous Sierra Leone for all. Thank you.
We actually use the One Health platform because we now know that diseases or health is not only limited within the health sector. There are a lot of confounding factors all over, and it lies mostly outside the ministry. You can talk about health and emergencies now and leave environment, you can leave agriculture, you can leave water resources, you can even leave social welfare behind. So what this thing has done for us is, with the plan and its implementation now, especially when we have the database and then the roster in place, now it has given us a fair knowledge as to who is in this country, what are the capacities that are in the country. With the plan, it has also helped us to know that what is needed for any sort of emergencies, and that will actually help us for every area to know what we have in here, what are the gaps, and what we need to source from.
We think the personal deployment plan will create a very huge impact in terms of being able to respond fast to some of these health emergencies that we call. When you have a personal deployment plan, you're able to really recruit and get people ready on the spot within a couple of minutes, because you already have the names, you have the list, you have their contacts, and these people are already ready to be deployed in any emergency. And it can be properly done because based on the type of emergency you have, these are the type of people you ask for. If you have an emergency that requires surgeons, you have to recruit and bring in surgeons. If you have an emergency that needs public health experts, you have to look at your list and get those people. And this list is already ready, and people are waiting anxiously to be deployed whenever it's necessary. So I think it will create a very big impact in saving lives, reducing morbidities and mortalities that are usually associated with some of these disasters we face in our country.
This whole business, in my view, started as a result of our experience with the Ebola epidemic, and then quickly followed by the mudslide, and then the COVID-19 pandemic. So it was on the basis of that the ministry come to the realization that some action needs to be done in respect of our preparedness and response in terms of emergency situation, because these things happen in quick succession, and then you want to think that if these things are happening, then some action needs to be done.
I remember the Wellington, we had to get people medics from all over the country and the world. Believe with that kind of collaboration, we'll be able to forge ahead, because you cannot have any emergency, you just depend on the Ministry of Health. If we have international medics coming, you need to involve the Ministry of Foreign Affairs. You need to involve the Ministry of Immigration in terms of visas. For the security, you need to involve awareness, you need to involve the police. So all these groups coming together are very relevant to see that we actualize whenever we have an emergency.
I think we learned a lot during the COVID-19 pandemic. Prior to that, I think globally, countries were able to count on other countries to come and support. And we learned that during, a true pandemic, we can't count on that. And so every country had to have their own workforce that was capable of addressing the COVID-19 response. And what this will mean is that Sierra Leone will have a workforce that can actually deploy as part of a response, but that also we can continue with providing healthcare services so that you protect your healthcare services, but then you have a surge response personnel plan and group that then can be put forward. So, I think frequently it's a one or the other. You can either do one or the other because you don't have enough staff to do both. And I think the goal of this is to really ensure that Sierra Leone is prepared, and that when the next event happens, again, healthcare services can be maintained, but that you'll also have a surge workforce that can either backfill those services that are needed or go to the front lines for an outbreak, or like the Wellington fire, any kind of a response like that.
Well, the impact in this case is the preparation for staff from the Ministry of Finance, in order to, because for every response you need resources. Finance is the key. Without finance you cannot respond. It makes Ministry of Finance and the staff that have been rostered to respond quickly when and how they'll be required to respond. And I'm sure that this one will also help the Ministry of Finance to plan for any emergency in terms of response. You use your resources because you want to do it. You have to budget it, and those resources have to be budgeted. So we need personnel from the budget department that have the requisite experience in preparing response budgets.
For the National Disaster Management Agency, we work very closely with the Ministry of Health, as we are in charge of coordinations whenever disaster strikes. Therefore, being part of this activity was a great development and success for the agency and the country in terms of even capacity building.
It is actually a requirement that we need for have as a country a personnel deployment plan. And with support from CDC, US CDC, and Metabiota being the technical support implementing partner through which CDC passed the fund, help the Ministry of Health through the Director of Health Security to develop this plan. And this plan actually has details of all of those who don't respond to emergencies in this country. And we also are trained on emergencies response.
The Immigration Department is part of the security sector. And because we are part of the security sectors, we control the border areas and screening migrants entering and leaving the country. And also we coordinate with all health authorities, especially with the Public Health Agency, to share information, because we process visas for personnel coming in and out of the country to respond to emergency cases.
That is, this plan will put us on another level of preparedness, as I mentioned earlier. It is a requirement in the JEE that we need to have a roster that is easily accessible and is multi-sectoral, not only for the Ministry of Health. So this is one requirement that we are fulfilling. If we have JEE tomorrow, we are going to pass that particular indicator. That is one. Number two, it makes response slightly easier for us because we now can easily refer to a document, to a tool where we can identify all staff that are available, that have the necessary skills, that have trained them to bring them together for them to respond. Meaning this will be to improve our speed, our efficiency in responding to outbreaks.